because in our opinion, there are a few of them. So let's get started right away here. We do own the company called Dr. Jen Natural. It's a toothpaste oral care line. We do have financial interest in that. Our learning objectives tonight are really to make you an expert at nanohydroxyapatite. You will be asked questions about this moving forward, and you probably already have in your own practice. We just want to make sure that you know the answers and you know the right answers and you're protecting your patients the best. All right, let's see. That's me. That's Peter. And this is us at the very beginning of our career. As you've already heard, I graduated from an orthodontic residency. I actually did a startup right away, right out of school. And this was my very first ad. It was before the internet, or before at least I could afford the internet. And so it was just in a local newspaper. And this is why we are here today. Believe it or not, this ad, every time I look at it, it reminds me. And the reason we're here is actually that little girl that I'm holding. That is our oldest daughter. Her name is Claudia. I had her during my residency program. And Claudia eventually grew up and she was in college. And she called me once during finals and said, I can't sleep. I can't study. My jaw is bothering me. Something's wrong. And so I called a friend who was a dentist in the area and said, oh gosh, can Claudia come and see you? And she did. She saw her after hours and she said, oh, I think she fractured a tooth. I'm going to send her to an endo. And this was in northern Minnesota. It wasn't easy to, number one, find a dentist, but also not easy to find a specialist. And so because she had to wait a bit to see the specialist, she was given some antibiotics to get her through at least the testing that she was doing, so she could sleep and she could study. And she saw the endo. The endo wasn't sure which tooth it was. He gave her more antibiotics. And after about 5 weeks of antibiotics, she developed C. diff. And her C. diff was strong enough, she was young, right? But her C. diff was strong enough that it really wiped her out. She had to be admitted into the Mayo Clinic in Rochester, Minnesota. She went in and out of ERs, and finally they just said, you know what, we're going to admit you and take care of this. And this was kind of a scary time for us. When we went to visit her, we had to wear, the yellow paper gowns and make sure we weren't bringing in any outside bugs to her and introducing any more to her already kind of roughed system. And while she was there for about a week. While she was there, her physicians told her and told us she really needed to be careful introducing new things to her gut. It was almost like she was an infant. So she had to be careful with what she ate, and she had to be careful with the products that she used. And so that was laundry detergent, soap, shampoo, all the stuff that you use. With a baby, you've got to be careful. With her, she had to be as well. And really, being in the dental field, I thought finding a natural clean ingredient toothpaste should be no problem, right? No problem. And we ordered everything you could imagine, every single toothpaste we could find that called itself clean or natural, we were ordering. And I was kind of searching and pouring through their ingredients, and I was disappointed with what I found. If it wasn't the ingredients, it was the fact that when they removed all of the ingredients that were maybe not so great for our body, they also removed the fluoride. And so they were no longer remineralizing the enamel. So some of the things that you can find in toothpaste today that will, play with our endocrine system negatively: petroleum products, it's called PEG, synthetic coloring, synthetic flavoring, and of course, sodium lauryl sulfate. Those are all really hard on our gut. And if we can get those out of there, that'd be better. A lot of the toothpaste formulations really haven't changed since the 1960s. And if you think about the things in dentistry that have, we used to take x-rays and develop them. And now, now we can do that digitally. We can scan instead of taking impressions. There's so many changes that have happened, but toothpaste is pretty much the same. Some of it contain chemicals that have been banned from food. Some of it contain chemicals that are banned in Europe. But in the United States, we still put it in our toothpaste. And it's just hard on bodies. We can do better, honestly. And so that's why we created the toothpaste. And that's how we dove into nanohydroxyapatite as a remineralizing agent. We're going to go through a few myths tonight. And so this is number one. All toothpaste sold in the United States is regulated by the FDA. It is not. Once the toothpaste company decides to pull fluoride out, the FDA no longer pays attention to that. They kind of ignore it. And so that means that these companies can put in any ingredient they want, and they can say anything they want about that toothpaste, and no one is regulating it. Go right ahead.
Oh, yeah. All right. That's my cue. Thanks, Dr. Jen. Yeah. So once again, our goal this evening is to help you become experts in understanding the most recent science behind nanohydroxyapatite. I would imagine at this point, most of you have heard nanohydroxyapatite. It's a buzz. There's a lot of patients already using it, and we can thank TikTok, Facebook, Instagram for putting information out there. Unfortunately, though, as Dr. Jen had mentioned, the Food and Drug Administration currently is not regulating nanohydroxyapatite. There are other countries that, and we'll talk about this, that have approved nanohydroxyapatite as an anti-caries medicine, and they have better transparency. But in the meantime, really, we want to help guide you, dental professionals, to help educate your patients on choosing a product with efficacy. In the meantime, yes, we have this environment called the Wild West. When Jennifer was looking for a nanohydroxyapatite toothpaste 5 years ago, she couldn't find a brand in the US that was following the science. So we had to hire a chemist out of Germany that had experience with nanohydroxyapatite. And that was one of the first things he advised us. He said, look, if you're going to make nanohydroxyapatite in the US, keep in mind, it's not regulated. There's this thing called the Wild West. And what that means is brands can put out anything without any repercussions, or at least, I guess, any accountability. And so let's go through some of the science behind nanohydroxyapatite, so you guys will be the experts. A little bit of Dentistry 101. We're going to talk about caries. Why do our patients need a remineralizing ingredient? So we see this increasing population number, a growing population that do not want fluoride. Well, why is it that they just can't go and use a fluoride-free toothpaste and be okay? Well, it's mainly due to bacteria like Streptococcus mutans and other bacteria that creates acids. We know that at the end of the day, if our patient's enamel has phosphate and calcium deficits over prolonged periods of time, caries will form. And one of the biggest contributors to phosphate and calcium deficits is acid-causing bacteria. So every time our patients consume sugars and starches, generally within 5 minutes, the first 5 minutes, they're going to be in a low pH event, causing demineralizing to occur. We know that once they're done eating, what happens is the pH levels will rise on their own, provided our patients have healthy saliva flow. Saliva has a number of things in it, but one of the most important ingredients is bicarbonate. But it takes about 40 minutes for pH levels to return back to neutral. Once the pH levels get back to neutral, then phosphate and calcium can go back into the enamel to remineralize. And where does that phosphate and calcium come from? It comes from the actual saliva. So really important takeaway. Our body does have the ability to heal itself, or at least the enamel to remineralize, provided our patients have healthy saliva flow. But what can we do? What can we do to help accelerate phosphate and calcium back into the enamel? Or what can we do to reduce the amount of demineralizing occurring? Well, there's really two ingredients that we'll talk about tonight that can do that are proven by science. One is fluoride. So I'm going to do a quick recap on fluoride, and then we'll talk about nanohydroxyapatite. They function differently, but they both are proven to help remineralize enamel. Number one, fluoride. How does fluoride work? With fluoride, we get more of a chemical reaction. If we look at our enamel, 97% of the enamel is hydroxyapatite. When we introduce fluoride on the enamel surfaces, fluoroapatite is created. What happens is the fluoride ions replace the hydroxy group, creating fluoroapatite. So we see a couple of things occurring here to help reduce phosphate and calcium deficits. Number one, fluoroapatite will lower the critical pH level of our enamel from about 5.5 to 4.5. So when our patients are in these low pH cycling events, they're going to have less demineralizing. That's a good thing. The second thing fluoroapatite can be very effective at is pulling in more phosphate and calcium ions back into the enamel. And the reason for that is fluoride ions are dense and they're negatively charged.
I'm just going to say, I went to dental school. Many of you, probably all of you, went to dental school as well. I don't know if I missed this in dental school, if I wasn't paying attention, but I did not realize that fluoride needed calcium and phosphate to bind together to actually work. And so that's the part when we were pouring through, PubMed studies and things like that. It's like, oh my gosh, why didn't I know this? But hopefully all of you are a lot smarter than me and already knew it, but now you do. Fluoride needs calcium and phosphate to work.
Very good. Thank you, Dr. Jen. And this is really important when we start to diagnose or at least do discovery with our patients. The reason for this is xerostomia it's a growing problem with a lot of our patients. Studies show that over 30% of Americans now have some type of xerostomia. What causes xerostomia? You guys know this. Over 50% of adults 75 and older have xerostomia. Here's a really sad statistic. There's over 400 prescription medications in the US that are linked to xerostomia. Even with young children, Adderall causes xerostomia. Of course, the common ones would be statins, diabetic medication. But if your patients have some type of medication that impacts their saliva flow, at the end of the day, it will impact fluoride's ability to remineralize. And so that's really the Achilles heel for fluoride. Without phosphate and calcium available, fluoride cannot remineralize the enamel. It's dependent on healthy saliva flow. We are going to reference some studies that are on the National Library of Medicine, PubMed. There's one study referencing this. It's published May of 2018, and I'll read it to you. It says, fluoride require calcium and phosphate ions from the saliva to improve the natural remineralizing process. Further on in this study, they say for xerostomia patients, oral care products with the addition of calcium and phosphate are recommended in order to compensate phosphate and calcium deficiencies. So when you're seeing patients come in and they have high caries, and it looks like they have a fairly good diet and they have a good oral care routine, one of the things we would recommend is have a good discussion with them. Are they on a medication? I know some people that are going through certain health issues, they consider it private. For example, depression medications could cause xerostomia. The other things to factor in is with small children. There's studies showing anywhere from 30 to 40% of young children are mouth breathers. We have obesity. There's a number of things, chemotherapy. Yeah, there's a number of things that can contribute to xerostomia. The biggest takeaway here, though, is if your patients have any type of xerostomia and they're on fluoride, they are at higher risk for caries. So what is the solution? This is where NANO HYDROXYAPATITE can actually come into play. Oh, this was a slide I forgot to mention. There it is there. 3 years. You want to go over that, Dr. Jen?
Yeah, I can. Essentially, it says that, a lot of the younger kids do mouth breathe. And so as a mouth breather, it is, hard on our enamel and it reduces the saliva in the mouth. They're more likely to get decay.
All right. So what is NANO HYDROXYAPATITE? Why can this be a solution for patients with xerostomia? Equally important, why can NANO HYDROXYAPATITE be a replacement for fluoride with delivering effective remineralizing? Well, if we break down NANO HYDROXYAPATITE, if you haven't seen it close up, I've got some in a bottle here. You probably can't see it.
It looks like powdered sugar.
Yeah, it looks like crystals, but the chemical composition of NANO HYDROXYAPATITE, it's calcium, phosphate, oxygen, and hydrogen. As we said earlier.
Let's say the first two again. What is it, Mike?
Calcium
and phosphate. Okay, just checking.
Okay, yeah, there you go. As we said earlier, one of the biggest contributors to caries is having an offset or a deficit of phosphate and calcium. And so, yes, NANO HYDROXYAPATITE really is what our enamel needs back in it. NANO HYDROXYAPATITE is biocompatible. It's non-toxic. We get a lot of questions from offices, especially holistic offices, whether or not NANO HYDROXYAPATITE is safe. For those families that you have that do not want fluoride, they're going to be a little bit more concerned with new ingredients, and that will be a question they will ask. So how do we answer that? We refer them to the European Commission Scientific Committee on Consumer Safety. Europe is much more restrict on oral care products. For example, if you're in Europe and you're a heavy wine drinker, you go to Italy and you're drinking lots of red wine and you need to, give your teeth a little bit of boost. Good luck finding a over-the-counter hydrogen peroxide whitening strip. You cannot buy hydrogen peroxide over the counter. You cannot buy toothpaste with titanium dioxide in it. Titanium dioxide is just so happens to be a common ingredient in a lot of natural brands to make the toothpaste look white. But the reason I bring this up is the European Commission, as strict as they are, they approved NANO HYDROXYAPATITE in toothpaste March of 2023. The Safety Commission report is pretty extensive. We've read it. Dr. Jen has actually met with the European Commission in Luxembourg. Very few manufacturers have met with the European Union, but within their safety report, basically they said nanohydroxyapatite doesn't cause cell toxicity or doesn't pose a threat to the human body, provided, number one, that the crystals are rod-shaped and that the toothpaste does not exceed 10%. However, we are in the Wild West, as we said before, and there's some brands that are putting out some misinformation about nanohydroxyapatite. And you want to speak to that?
Yeah, this is one of the things that we hear from some brands is that the European Commission, that the study that Peter just referenced, approved only certain nanohydroxyapatite manufacturers, and that's just not true. And that's actually why I wanted to meet with them to see. They really recommended the 10% and the rod shaped. They did not say that people or the brands need to use a certain manufacturer for the best result. Now, nanohydroxyapatite, it does come in several different shapes. And you can see the 4 here. Our body makes it, right? It's in our bones, it's in our teeth. And the shape that we make naturally is actually on the right, the needle shape. But the one that the European Commission recommended for use in toothpaste is on the left. That's the rod shape. Myth number 3, there is little history or science behind nanohydroxyapatite's ability to remineralize tooth enamel. You will hear this as well. There are some brands that say, oh, you know, we don't know enough about nanohydroxyapatite, we can't put it in toothpaste.
So that's a good point. If you guys are historian buffs and you study toothpaste goes back thousands of years, and it was the Egyptians that were really the first to invent and use toothpaste. And it just so happens they were using hydroxyapatite in their toothpaste. It dates back anywhere from 3000 to 5000 BC. The type of hydroxyapatite they were using was eggshell. So yes, it's been around for quite a while, but as far as hard research goes, well, you know, who created hydroxyapatite, and when did we start seeing studies? It wasn't until the late 60s, early 70s that hydroxyapatite really surfaced as a replacement for fluoride. And we have to give credit where credit was due, and it was NASA. So a lot of people ask, you know, why was NASA making toothpaste? Well, if we look at the first space capsules that went into outer space, they were very confined. It wasn't quite as glamorous of a job as most people thought, because the first astronauts, they didn't have a toilet. They had to wear diapers. They had to swallow their toothpaste. So NASA had a couple concerns early on with their space program. When the astronauts were returning to Earth, they noticed that they had mineral loss or demineralizing occurring at higher levels on their enamel for one reason in particular, zero gravity. As we said earlier, for fluoride to be effective, we have to have healthy saliva flow. Well, within the NASA program, they realized that gravity had an impact, or zero gravity environment had an impact on healthy saliva flow. So NASA set out to create a clean ingredient toothpaste that was edible, but that was also not impacted by zero gravity environments. And that's really when hydroxyapatite surfaced. So NASA discovered hydroxyapatite in the late 60s, early 70s. There's a pharmaceutical company out of Japan called Sanji. Sanji bought the patent in 1974. So think about this. Hydroxyapatite has been in toothpaste for 50 years. So even though it might be new to your office, we have over half of a century of history behind it. Now,
can I interrupt you? The one thing I want to say, that if you go back to the time when NASA put it in the toothpaste and then Sanji grabbed on, you know, to the formula, and essentially what happened at that same time is the United States started to put fluoride in toothpaste. Japan put nanohydroxyapatite in. And so Japan recognizes nanohydroxyapatite today as a medicine, whereas the United States recognizes fluoride as a medicine. So I think it's really interesting history. It could have really gone either way, but the United States happened to grab fluoride instead of the nanohydroxyapatite.
Yeah, and this is actually a slide referencing what Dr. Jen is saying, that it was in 1993, about 20 years after Sanji bought the patent from NASA, when the Japanese government, the equivalent to the Food and Drug Administration, it was their Ministry of Health and Welfare, they signed off on Sanji's, they call it a medical hydroxyapatite, but they signed off on it as an anti-caries ingredient. I think eventually in the U.S., we'll see the Food and Drug Administration embrace it as long as we continue to see solid studies. But as of today, no, it is not regulated. Let's see, I wanted to go back to this previous slide. Just a little history on Sanji's toothpaste. Their brand is called AppGuard. Their first toothpaste was released in 1980. They spent 6 years advancing, developing hydroxyapatite before they released it in market. And it took them another 23 years before they developed the technology to create a nano crystal. And that's really when hydroxyapatite really started getting a lot of attention as an effective remineralizing ingredient. And we'll talk about nano versus microcrystals here in a little bit, but there is a difference. And yes, technology constantly evolves.
This is a photo of one of our other children. His name is Gabe. Gabe is currently a dental student in Utah, and he just completed a master's program about a year ago. And his thesis, a biomedical master's, his thesis was on nano hydroxyapatite. So this really is kind of a family thing here. Gabe has been super supportive in searching PubMed for us and finding a lot of the studies that you'll see on this presentation today.
So yeah, as we said earlier, even though hydroxyapatite might be new to your office, we have quite a bit of history that we can be grateful for, over 50 years. And if you're looking for hard studies, you're really science-based practitioner, we do recommend that you go to the National Library of Medicine. We're going to reference a few of the clinical studies. I typed in nano hydroxyapatite. This slide was created about 2 months ago. What's interesting is the numbers keep going up. There's currently over 3,000 published studies on the National Library on nano hydroxyapatite. If you can see the timelines, it shows 1970 to 2024. Most of these studies were done in the last 5 years. This is a material that's not going away. We can thank Sanji for a lot of the research. And not only is nano hydroxyapatite used in toothpaste, but it's also used in other medical applications. For example, if you look at the image in the upper left-hand corner, that is a hip replacement. Orthopedic surgeons have found if they coat hip joints or hip replacements with hydroxyapatite, they get better biocompatibility. Why is that? Well, 60% of our bone composition is hydroxyapatite. Other applications, we have, let's see, bone regeneration. I guess as far as replacements, it's not limited to the hip. There's also shoulder, knee replacements. It's used in bone regeneration, tissue engineering, cartilage repair,
implants,
dental implants, coating dental implants for the same reason, better biocompatibility. It's used to create artificial bone blocks to aid in bone grafting. It's used in cancer detection, cancer research. All night we could talk about the different applications of hydroxyapatite and nano hydroxyapatite. However, for tonight's purpose, we really want to focus on how do these crystals work in toothpaste.
The one thing I was going to add that Peter didn't mention is it's actually, they coat it on medications now too. So there are some meds that our body just won't take. And so previously they needed to be given via IV only. And what they found is that if they put it in a capsule and they coat that capsule with nano hydroxyapatite, then it can be taken orally and the body will accept that medication.
And once again, we can thank Sanji for this. And, you know, they've just got a great company. They've invested over 4 decades, hundreds of millions of dollars on research. We can be thankful for advanced materials like this, not just to help in medical applications, but in toothpaste. So let's talk about this. How do these crystals, how do these nano hydroxyapatite crystals work to help fight caries, or I guess to better state it is how do they help remineralize enamel? We're going to break this down. The crystals really do 4 things. Number 1, the crystals are great at adhering to proteins and bacteria like Streptococcus mutans. The crystal structure is a hexagonal structure. There's a lot of surface area. If you look at the image on the lower left-hand side of this slide, you'll see capsule structures. That's what a rod-shaped nano hydroxyapatite crystal looks like. I saw a question that came up, why is rod best? This is what the European Commission approved because of its shape. They believe that it's less likely to cause cell toxicity versus the needle shape they call suspect, even though there isn't any hard science on that. But I just wanted to answer that question. I saw it come up, but I think this image is wonderful. It really shows nano hydroxyapatite's ability to reduce biofilm. If we can reduce biofilm or plaque, It's going to reduce the amount of acid-causing bacteria throughout the day, which is going to reduce the amount of demineralizing. So that's the first thing nanohydroxyapatite will do. Number two, the crystals will fill in microlesions, surface pores. And this does several things. Number one, it will provide some surface remineralizing. We're also going to get an elevation of whitening. The crystals are a white crystal. And so you'll see a little bit of elevation and whitening, but they'll also make the tooth surface smooth. And this makes it more difficult for plaque and stains to reattach. Number three, most importantly, if the crystals are nanocrystals, crystal size smaller than 100 nanometers, the crystals have the ability to penetrate surface pores. Or to be more technical, if we look at number three on the left, if we look at the crystal structure of our enamel, hydroxyapatite, there's hexagonal crystal structures, but between these rod crystal structures, there's gaps or spaces. And this is that allows acid to get below the surface of the enamel to create incipient caries. There's some images on the lower left-hand side of this slide. These images were taken by the University of Texas Health Science Center. And I think this is a good example of how nanohydroxyapatite crystals have the ability to penetrate surface pores, but also dentin tubules to deliver phosphate and calcium crystals below the surface of the enamel to help reduce incipient caries. The image on the left, we can see just below the surface, we see a gray band. That's what incipient caries looks like. As you guys know, incipient caries is one step before actual tooth decay. Well, with this study, they applied nanohydroxyapatite over 14 pH cycling events, 7 days, and took the image over again. If you look at the image on the right, we can see that that gray band has dissipated, where the nanohydroxyapatite crystals had the ability to remineralize incipient caries. So nanohydroxyapatite, really number three, if the crystals are the right size, we're going to see remineralizing below the surface of the enamel. And then lastly, nanohydroxyapatite's ability to manage hypersensitivity without a pain blocker. Most toothpaste companies will use an ingredient called potassium nitrate. Potassium nitrate is a pain blocker. How that functions is once it gets to the nerve of the tooth, it nulls the pain signal between the nerve of the tooth to the brain. But it really doesn't do a whole lot to manage the actual the underlying problem. It more or less goes after the symptoms, where nanohydroxyapatite in itself is going to go in, it's going to coat exposed areas of dentin, weak enamel, but also occlude the dentin tubules. So there's at least a dozen studies on PubMed, like the one on the left, showing nanohydroxyapatite's ability to manage hypersensitivity. Picture's worth 1,000 words. If you look at image A, we can see exposed dentin tubules before brushing, and then image B is after. It's great at managing hypersensitivity. And I didn't mention this earlier, but when your patients do brush with nanohydroxyapatite, it's best that they do not rinse. Similar to fluoride. Fluoride, the American Dental Association recommends when brushing with fluoride, just to spit, not to rinse. The same is true with nanohydroxyapatite. Now, I want to touch on some studies supporting the claim that nanohydroxyapatite can deliver the same remineralizing levels as fluoride. If you narrow your search on PubMed, the National Library of Medicine, and if you type in nanohydroxyapatite toothpaste, you'll see at least 52 studies like this. But I'm going to reference a couple of studies to support the claims that it can be just as effective as fluoride at remineralizing. With this study, it was published September of 2019. They tested 3 different toothpaste side by side. One was 10% nanohydroxyapatite, one was calcium sodium phosphacylate, and then fluoride. How they do these studies typically is they'll take healthy extracted teeth, create a lesion on that surface of the enamel through applying acid over a series of events. And that's what we're looking at in the imagery on the lower left-hand side. It's the same tooth, taken 6 different images over a time frame after acid has been applied. If you look at image F, you'll see a lesion on the surface. After creating lesion on these healthy extracted teeth, then they take a baseline measurement. With this study, they used a polarized light microscope. If we look at the top row on the images on the right, those are 3 different examples of teeth that had a lesion created. The top row, if you look, there's a gray band. That's how deep the lesion went. The respective photo under the top row is taken 7 days after applying a different toothpaste. There are 3 different toothpastes, but these are 3 different teeth. Now, they had quite a few more samples in this group. But ultimately, what they did is they tested 10% nanohydroxyapatite against fluoride to determine how much remineralizing had occurred. With the naked eye, it's really difficult to determine which product performed best. So they were able to summarize the mean score with their metric devices. And what they discovered is that the AppGuard Royal, which contains 10% nanohydroxyapatite, performed best. The remineralizing levels were a little over 10%. The calcium sodium phosphacylate was a little over 6%. And then the fluoride at 1,450 parts per million performed well, but not as well as 10% nanohydroxyapatite. I have a lot of respect for the study because they didn't test nanohydroxyapatite at 10% against a weak level of fluoride. 1,450 parts is a higher level over-the-counter level fluoride. And so I think that's a really important takeaway. We get a lot of questions about in vivo studies. Well, that was in vitro. What about in vivo? This is an in vivo study done at the University of San Antonio, Texas. Very similar study. They took healthy extracted teeth, created lesions, but they cut blocks out of the lesion area, attached that block of lesion enamel on an orthodontic attachment, which we can see in the image in the lower left-hand side. They had one group brush with fluoride for 4 weeks, one group brush with 10% nanohydroxyapatite for 4 weeks. They removed the attachments, measured the amount of reduction in the lesion area or how much remineralizing had occurred. With this study, the levels were pretty much identical. As I said earlier, there's over 50 studies similar to this showing the efficacy of nanohydroxyapatite's ability to remineralize enamel at the same levels as fluoride. Now, really important takeaway as we move forward is that to get these outcomes, it is particle size and concentration dependent. So here's another myth buster here, Dr. Jen.
So myth number 4, concentration of nanohydroxyapatite does not matter. You will hear that. We have heard that several times. And honestly, the studies just don't support this. That is a myth.
You want to talk about this one at all?
No, go right ahead.
Okay.
Go right ahead.
Yeah. So we're making a claim, and we are a manufacturer, so we have to back it up by science. And I would strongly encourage you, if you have other brands that are saying things that are conflicting with the data that we're presenting, ask for third-party non-funded clinical studies. And if you guys come across anything that is conflicting with our presentation, send it our way. We'll be happy to update our presentation, but we are on top of the science. So Dr. Jen had said concentration matters. It does matter. There's studies testing different concentrations. This is a study that was published June of 2009, testing the theory that as you change concentrations, remineralizing levels will change accordingly. They tested 1, 5, 10, and 15%. We don't have the 15% bar up because what they found in this study, and I'll read in the abstract, but basically nanohydroxyapatite plateaus at 10%. Within this study, they said there was no significant difference between 10 and 15%. However, when you cut the concentrations below 10%, remineralizing levels will drop significantly. The gray bar represents 1, the teal bar represents 5. Our son, who's in dental school, he keeps sending me these TikTok ads. He's like, Dad, here's another brand claiming concentration doesn't matter. And so I was watching the ad, and it was the brand saying, well, there are brands saying that 10% is what you need. That's not true. You only need 5%. Well, we're not necessarily telling you that 10% is optimal. What we're sharing with you is that the science that's published on the National Library of Medicine, they're claiming that 10% offers the optimal concentration. Here's another study supporting this. As dental professionals, we want to use systematic reviews or meta-analysis. This is a meta-analysis. It's a scoping review study. This was published May of 2022. Within the study, they were very clear. It says, yes, nanohydroxyapatite can do all of these wonderful things. However, it also says the optimal concentration is 10%.
So I just want to talk to you a little bit. I mean, obviously we have toothpaste, right? And our toothpaste has 10% nanohydroxyapatite in it. And it took us a while to create this. We hired a retired toothpaste chemist. And essentially, when we finally found our formula, and we would go to all of these, United States manufacturers and say, hey, can you mix this up? Can you put it in tubes for us? All of them said, well, why are you putting in 10%? You don't need to put in 10%. Just sprinkle it in 1, 2, 3%. That's good enough. And our response was, well, it's not good enough because all of the studies say 10% is optimal. And they all said, you know what? Nobody reads the studies. 1, 2, 3% is good enough. But that's where, and really, I think that's why we're here, is because we disagreed. If the studies say 10%, you want 10%. You want optimal remineralization.
So once again, we'd be happy to send links to this. Actually, they're on the back end if you want to read more about that. Now, as far as concentration goes, to make it even more difficult, there's brands out there that are using a liquid nanohydroxyapatite, and they'll start saying, well, we use 20% of a 15% concentration, and then somewhere they'll may or may not list the actual final concentration. So I think this is really important takeaway. Nanohydroxyapatite, when you purchase it to make it in toothpaste, and we've tried every version of nanohydroxyapatite over the last 5 years, and we're constantly testing new nanohydroxyapatite. We've been testing eggshell recently, but it can come in a pure form, which is a powdered, or it can come in a diluted liquid concentration. Well, there's brands that use a liquid concentration. Well, generally, the way this works is 15% of this bottle is nanohydroxyapatite, 5% is a potassium chloride, which can also be used as a pain blocker, and the rest is water. So if you take a tube of toothpaste and you pour in, I guess, 20% of a diluted concentration, your final concentration generally comes out anywhere between 2 to 3%. So if you're guiding your patients on, following the science by using 10%, you want to make sure it's the final concentration.
Yeah, and I would just reiterate that it's so easy to read something and think, oh, they're putting in 15%. That's even better. Make sure you're looking at the final concentration. Myth number 5, microcrystals are as effective as nanocrystals. Micro is another thing you're going to hear. And I think we have a really cool photo on this actually, but this is a myth. It needs to be nano to get into the nano-sized enamel pores and the dentin tubules.
Oh, wonderful. Yeah, we just had a question come up. What's the difference between nano and non-nano? As we said earlier, when NASA first created hydroxyapatite, it was a microcrystal. So that's what we have on the right. This is an animation of exposed dentin. We got to think about the tooth surface the same way. For crystals to remineralize incipient caries, to penetrate surface pores, the crystals have to be less than 100 nanometers. NASA created the microcrystal in the early 70s, but it took Sanji, or I guess Sanji's a pharmaceutical company. It wasn't until 2003, about 30 years after they bought the patent, were they able to come up with the technology to create nanocrystals. If you look at the imagery on the left, the nanocrystals are small enough to not only penetrate surface pores, but get into the dentin tubules, occlude them. So the studies supporting nanohydroxyapatite to be just as effective as fluoride at remineralizing that we referenced, they were done using a nanocrystal. Why are brands putting microcrystals in? Well, one of the reasons is a microcrystal costs 1/5 the cost. And so that was another suggestion that we had the manufacturers advise us on. They said, look, your toothpaste is going to be too expensive. If you put nano, nobody's going to buy it. Just put in micro or put diluted concentrations. Now, there are some brands that will mix the two, and they'll say, oh, micro is good. Well, ask for the science. We have not seen any publications supporting micro to be superior to nano. In fact, PubMed has a study, which I will reference. It's on the top of the slide. It was published August of 2021, and it says microhydroxyapatite particles run 5 to 10 microns in size. These are too large, and you can see that in the imagery on the right to penetrate surface pores or dentin tubules. Nanohydroxyapatite can also help reduce root caries. This was a study April of 2011. I'll read the conclusion. It says for dentine, even higher remineralizing effects could be achieved with nanohydroxyapatite toothpaste compared to fluoride. So yes, it does some wonderful things. It makes sense. There's a lot of folks that ask about MI paste, in particular CPP and ACP. This is a liquid version of phosphate calcium. I'm sure most of you are familiar with liquid phosphate and calcium. And it does work. It does provide some level of remineralizing, but how does it compare to 10% nanohydroxyapatite? There was a study published winter of 2015, basically testing nanohydroxyapatite fluoride and CCP, ACP, or MI paste. And the bar charts on the left basically show the results. The 10% nanohydroxyapatite performed best. I will read the conclusion. It says it was concluded that nanohydroxyapatite and fluoride had the potential to remineralize initial enamel lesions. CCP, ACP can be used as an effective adjunct to fluoride therapy, but cannot be used as an alternative to fluoride. This just further supports that nanohydroxyapatite does have the ability to replace fluoride. But nanohydroxyapatite is also effective at, I shouldn't say effective, it can help elevate whitening. This is a study showing it is concentration dependent. You can guess what concentration they determined was optimal. It was 10%. So most of the studies showing nanohydroxyapatite to be effective at managing hypersensitivity, remineralizing, and whitening, they were all using 10% as the optimal concentration. You want to talk about this lady here?
Yeah, this is our daughter, Claudia. She is also currently a dental student. She's in Minnesota. She's a D4. So she'll be done in less than a year. She did make it through her C. diff and live to tell about it. She's got a lot of stories, but this is her with one of her professors.
Very good. I saw a question come up. It said, how do you know if a toothpaste is using rod or Morpheus? You have to ask the manufacturer. If manufacturers are not providing transparency, it's probably suspect. And I would say same thing with concentration or particle size. I think transparency is essential for us to make good recommendations. We'll talk about high prescription fluoride a little bit. I think this is just counterintuitive. Most people don't read the fine print on the high prescription fluoride warning labels. We have 2 kids that attend 2 different dental schools, and their recommendations for high caries patients was high prescription fluoride, yet there was no direction on reading the fine print. Well, within the fine print, I think it's really interesting. My guess is some of your offices are probably using high prescription fluoride toothpaste for pediatric patients. Well, I want to bring this to your attention. This is a warning label that the Food and Drug Administration requires on all high prescription fluoride toothpaste. And it says for pediatric patients, ages 6 to 16, they're supposed to spit and then rinse thoroughly. Well, the American Dental Association, as we mentioned earlier, recommends that when using fluoride at home, not to rinse for its effectiveness. So just food for thought. It's a little bit counterintuitive to recommend a high prescription fluoride product for a child between 6 and 16, because the Food and Drug Administration's directions are that they rinse after brushing with fluoride. Well, for fluoride to create fluoroapatite, we want to leave it on the enamel for at least 30 minutes without consuming foods or beverage. So what is the better solution? What is a better solution for a 40-year-old prescription fluoride toothpaste? Well, what Dr. Jennifer had found is that there is synergy. There's synergistic benefits from combining nanohydroxyapatite with fluoride. Now, I just made a claim, so hold me to it. Say, Peter, you're making a claim. This is the Wild West, right? Well,
I think the thing to think about, though, is getting back to nanohydroxyapatite is calcium and phosphate. Fluoride needs calcium and phosphate to work. Okay, so if you combine the two, which is really what we wondered, what's going to happen? And there is studies that show that it actually works synergistically together.
Yeah, and there's a lot of history, not just on nanohydroxyapatite, but combining nanohydroxyapatite and fluoride. And a lot of this came out of Germany. The first chemist we worked with was out of Germany, and he brought this to our attention. So there are studies on PubMed. This is one published winter of 2017, where they combine high concentrations of nanohydroxyapatite with over-the-counter levels of fluoride. The data points on the right just show that the teal bar, that's 7% nanohydroxyapatite with 1,000 parts per million, which just so happens to be 0.22% fluoride, against fluoride alone, 0.22%. So yes, you do get synergy if you combine the two. So instead of thinking that, if you have a patient that has high caries, that we have to automatically go to high prescription fluoride toothpaste. On a side note, that was created 40 years ago, before nanohydroxyapatite was available, before xylitol was available. Instead of approaching helping high caries patients fight caries with high prescription, we can offer them more of an advanced formulation by combining nanohydroxyapatite with fluoride. So Dr. Jen created a product using optimal concentrations of nanohydroxyapatite at 10% over-the-counter levels of fluoride with high concentrations of xylitol. And we released that product a little over a year ago. We'll talk about that more later, but we just want to talk about some of the science supporting the synergy if you combine the two. And so we had this product that has 10% nanohydroxyapatite, over-the-counter levels of fluoride, and 14% xylitol, higher concentrations of xylitol. And we had it tested in a lab against high prescription fluoride toothpaste at 5,000 parts per million. Now, we did want to test it in the worst case environment, which was xerostomia. We had this tested in a third-party lab called Therametric Technologies. It was a pilot study, and there's the data. And I don't think it's a surprise to anybody if you read the clinical studies, if you read the research behind nanohydroxyapatite. But the super.
I'm going to tell you, as a dentist, it was a surprise to me. You understand the science behind it, but I was taught if somebody has xerostomia, if they have high caries, throw a lot of fluoride at them. And so it makes sense that adding, nanohydroxyapatite and just over-the-counter fluoride would work better. I didn't think we expected it to work this much better.
That's true. I think the bigger takeaway here is from everything we've led up on is that fluoride does have benefits. It's great at creating fluoroapatite, but remineralizing, it does need calcium and phosphate, which is available. But if we can combine the two, we are able to give our patients double the action to help remineralize and strengthen the enamel. And this is just one study that we have two studies. We showed you a published study on PubMed. This was a study on PubMed showing that you get synergy between the two, but this study was directly done on a product with 10% nanohydroxyapatite. Let's see, quick review. Let's do a review and we'll open it up for questions. So how does nanohydroxyapatite work? I'll just back up. Fluoride creates fluoroapatite. That's going to lower the critical pH. It's also going to promote more phosphate and calcium in, provided we have saliva. Nanohydroxyapatite functions differently. Number one, the crystals will reduce biofilm. If we can reduce biofilm or plaque, we're going to have less demineralizing occurring with our patients. Number two, it'll fill in microlesion surface pores, provide surface remineralizing, but making it more difficult for plaque to reattach. Number three, most importantly, if it's a nanocrystal, we want nanocrystals smaller than 100 nanometers. The crystals will be able to penetrate surface pores to help remineralize incipient caries, deliver phosphate and calcium below the surface of the enamel, but also to help occlude dentin tubules to remineralize areas below the surface of the dentin. And then lastly, nanohydroxyapatite is great for managing hypersensitivity without an added pain blocker. So that's pretty much the recap on nanohydroxyapatite. Dr. Rolling, why don't we go ahead and open it up for more questions?
Okay, there are quite a few here, and they're great questions. I'm going to go back to the top. I know, Peter, that you had addressed some of these, so if I end up repeating, just let me know.
I couldn't resist. Sorry.
I know, that's fine. Sometimes it's all about the timing. Question about nanohydroxyapatite crossing the blood-brain barrier. We've had a few of those this evening.
Yeah, that's a good question. There's actually a study out there. We have a researcher on our team. He's awesome. And there is a study showing that nanohydroxyapatite within the blood-brain barrier reduces aluminum from the human body. So I guess I can share that study with you guys. It's a fairly new study from what we're aware of regarding cell toxicity. And I think that's probably the biggest question. The European Commission Safety Commission goes into great detail, and we are not physicians. We're not, I guess, doctors of what do you call blood, studying blood and medical. I was thinking hematologist, but so I would say reference that study. And as far as the blood barrier, there's actually a study showing that nanohydroxyapatite can be beneficial at reducing aluminum in the bloodstream, which is quite amazing. So why don't I do that? Why don't we find those studies that we can share with the person asking that question?
I also think,
go ahead.
Sorry. The European Commission, the reason that they did that study that they finalized last year was to research whether or not nanohydroxyapatite was safe to use in toothpaste. And they did evaluate the blood-brain barrier. And that's why they recommended using rod shape.
Yeah, and I think that was one of the questions that came up as well. In their opinion, rod is less likely to penetrate the cell.
Is this product okay for pregnant and nursing women?
You know, I have to say, I'm not going to say it is or it isn't. I really recommend that you talk with your OBGYN to make that decision.
What we do know is that nanohydroxyapatite is used in certain powdered baby food manufacturers. The reason for that is it's an excellent source of phosphate and calcium. When we swallow toothpaste with nanohydroxyapatite, what happens is the crystals dissolve. As we said earlier, hydroxyapatite's critical pH is 5.5. That's when crystals, or actually hydroxyapatite starts to break down. When we swallow hydroxyapatite, the crystals get into our stomach. The typical pH range in our gut lining is anywhere from between 1.5 and 3.5. So overall, nanohydroxyapatite is considered safe to swallow, dissolves, delivering phosphate and calcium. And that's why, I guess it is a little bit of a surprise.
That's why it's in baby food.
There's certain baby food manufacturers that include it in their powdered formulation as a delivery source for phosphate and calcium.
Is this just for long-term use or for high-risk situations on the short term?
I really think that this is just for daily use. There are some patients that you might come across that will refuse to use fluoride. So this is an alternative that is just as effective at remineralizing. And there are some patients that use sensitivity toothpaste. And I'm going to say my dad is actually one of them. He's a lifelong user of a sensitivity toothpaste. He did not want to move away from it. He did not want to try this paste. And after 2 weeks, he said, I need more of that. It works better.
Yeah, and I guess to further answer that question, as long as our patients have bacteria in their mouth and they're on this lovely Western American diet with consuming sugars and starches, we're going to have demineralizing occurring. And it'd be nice if in a perfect world, and actually we're talking to Gabe, our son, not to get sidetracked, but there are attempts to creating a shot, I guess, or vaccine, if you will, for certain bacteria like Streptococcus mutans. They've been working on this for 40 years, but until they come out with a vaccine that will eliminate Streptococcus and other acid-causing bacteria, our enamel needs daily remineralizing. And it doesn't matter if you're using fluoride or nanohydroxyapatite. If you're not using one consistently, assuming you have acid-causing bacteria and you on this lovely Western American diet, it's something we have to do daily.
There's a question about age. What age can you start using it?
Honestly, I think you can start using it immediately, especially the fluoride-free. We have just a nanohydroxyapatite paste, which is fine to use at any age.
I think this is more of a comment. Since this helps reduce biofilm, it makes sense to me that it would be great for ortho patients and those with poor dexterity and poor dental hygiene.
Yes. There's I'm sorry. Go ahead.
No. Another comment. I've already switched my sensitivity patients to this product. We use this daily to desensitize before treatment, and it's great.
Nice.
Someone else, I need this. Question. Is xylitol safe in the toothpaste?
Xylitol is kind of a hot button right now, isn't it? Because it's gotten a bad rap over the last few days. I'm going to say if you look at that particular study that people are citing where xylitol is not safe to use, there are only 10 subjects in that study. So their sample size was 10. And the sample size was also ingesting the xylitol. So they were swallowing it, they were eating it. And so if you're eating a lot of really just about anything, it's not going to be good for you. We don't recommend that you eat this toothpaste. So don't eat it. Just use it to brush. Typically when we brush, we swallow about 5 to 7% of what we are brushing with. But in our opinion, the xylitol in this case is safe. I do want to mention, just with you mentioned orthodontic patients, there is a recent study, we don't have it here, that has been done on demineralization after you've removed orthodontic appliances. We grind off the adhesive that we use to bond the brackets or the attachments on, and it found that if you use a nanohydroxyapatite, that it will help remineralize more quickly.
A couple of questions here. Does it do a good job? Whoops, I took it to the other side. Sorry, guys. Just 1 second here. Does it do a good job of remineralizing white lesions post-ortho? We're asking the expert here.
It does. It does. And actually, I have to tell you, before we brought this out to just, for people to buy, we made this toothpaste for our family. We made it for our friends, and we made it for my patients. So a lot of my patients, we have tons of photos before and after using this paste, and I think it works really nicely.
Question, how is it marketed as a natural product if the nanohydroxyapatite is a synthetic form of hydroxyapatite?
That's a really good question. We don't market our product as a natural toothpaste. There are brands that do. If you look at our packaging and our website, it does say that it's a 10% nanohydroxyapatite. Most of our ingredients are natural. But no, that's a really good point. If there are brands out there that are calling their toothpaste natural toothpaste and they're using synthetic nanohydroxyapatite, but unless we have an error on our website, you bring it to our attention, we do not call our toothpaste natural. However, all of the ingredients that we've chosen with the manufacturers we source, we could follow. When we created this toothpaste, we wanted to source ingredients that were safe for our daughter. Good question, though.
Another great questions tonight. Another great question. How strong is the bond of remineralization of nanohydroxyapatite compared to that of fluoride?
Ooh, that's a good question. I have not seen anything that's really interesting, that, has tested the bond strength.
Well, I'm going to go there a little bit.
Okay,
here.
go there a little bit.
Yeah, let's go back there. The study that we did, the pilot study we did, and I think this is really interesting. There's so many tests. I mean, we've spent tens of thousands of dollars in labs testing our materials against fluoride. But with that pilot study we did testing the super paste that has 10% nanohydroxyapatite over-the-counter levels of fluoride against high prescription fluoride, what they did as part of their testing requirements is they do an acid challenge test. So there's something we did. We used a Victor hardness test, or our labs did. So we simulated 14 pH cycling events applying the toothpaste. They did a Victor hardness test to determine how much remineralizing occurred on our super paste compared to 5,000. I'm not going to mention the brand. 5,000 parts per million toothpaste, and our remineralizing levels were 6 times higher. At the end of this test, they did an acid challenge test. And what they found is that the super paste outperformed the high prescription fluoride toothpaste at 5,000 parts per million by 10 times. So I don't know if that answers the question, but anytime you're working with labs, we want to check a few things. We want to check remineralizing, but we also want to determine how well these remineralizing areas stand up against acid. So on that particular study, we were actually very surprised that it performed 10 times higher than high prescription fluoride toothpaste, but that did have over-the-counter levels of fluoride.
Can you reiterate as we close here, another question, and I've seen a couple of these, so there's a little bit of confusion. Does the patient require healthy saliva for the toothpaste to provide calcium and phosphate uptake?
With nanohydroxyapatite within it, the nanohydroxyapatite is calcium and phosphate, so it's already in the toothpaste. They don't need saliva.
However, that's a good question. That's where, based on studies, including the study referenced on PubMed, fluoride does need a delivery source of phosphate and calcium to remineralize enamel. So to answer that question, yes, if you're brushing with fluoride, it's important that our patients have healthy phosphate and calcium available. Where are they going to get that from? It's from the saliva. And so if they're a xerostomia patient, their phosphate and calcium levels are compromised.
But this toothpaste.
Right. No, regarding the nanohydroxyapatite, that's why nanohydroxyapatite performs so much better than fluoride in a xerostomia environment. But back to that pilot study, that was a xerostomia environment. So we always want phosphate and calcium, and we want bicarbonate. We want saliva. Saliva is the fountain of youth. However, nanohydroxyapatite will serve your patients much better for the patients that have xerostomia.
I think our questions now are turning to product-related questions. And if we didn't get to your particular question, please reach out to Peter and Dr. Jen directly. We're going to go ahead and put the passcode up for the quiz. And then we're going to talk about Dr. Jen products. So please stay on to learn more. There are product questions about where do we purchase it? How do we get it in the hands of our patients? You'll learn all about that in 1 minute. We're going to put the code up, and then we're going to provide you with that information. There's their contact information. You do have this handout in your course folder. If you don't, tap on that red banner at the top of the screen. And I am going to go put that code up. It'll be up for 1 minute, and then we're putting up the Dr. Jen presentation. Please write that code down because I'm beginning to sound like a bingo barker. 621156. If you don't have the quiz, you do need the handout. Tap on that red banner at the top of the screen. Make sure that you save that for later because you'll need the quiz link. And I will put the quiz link for you in the chat area as well. And then we are going to go to Dr. Jen's presentation here. (621-156). I'll put it in the chat area as well. This is being recorded, and let me go ahead now. I will also re-announce this code in the chat area. We're going to bring up information on Dr. Jen's products here. And at the top of the screen, you will see their website magically appear in just a second. So Peter and Dr. Jen, take it away there.
Wonderful. Hey guys, number one, thank you for spending an hour of your time learning about nanohydroxyapatite. This lecture was not meant to promote our products. Really, we set out, our goal was to help you become experts in understanding nanohydroxyapatite. This was a problem for us 5 years ago. We couldn't find a company that was following the science within the US. Hopefully, after spending an hour, you know what to help guide, what you need to know to help guide your patients. So a little bit about our products. Please stay with us because you can get free samples of Dr. Jen's toothpaste. We're going to show you how to get free samples. I'll just go over a couple of things, but we've got the free samples for you to send to your office that you can try, most importantly. And if you love the product, that's great. If you don't, let us know. But ultimately, we talked about this before, for your families that do not want fluoride, what do we want to give them? We want to give them optimal caries protection, or I should say remineralizing in this case. And so what do your patient's enamel need? They need 10% nanohydroxyapatite. And yes, the second part was crystal size. And so yes, Dr. Jen's does follow the science. We use 10% final concentrations in all of our toothpaste, but we also use nano crystals. As mentioned earlier, micro is just too large to be effective at penetrating surface pores and dent and tubulos. And then, yes, we do follow the European safety guidelines. We use rod-shaped crystals as well. We have two fluoride-free versions. We have a strawberry and we have a cool mint. We have an orange that will be
orange marshmallow.
Yeah, orange marshmallow that will be coming out here in the near future. Uh-oh, Dr. Rowling, did I do something wrong here? Uh-oh. I don't know if she can hear me. Dr. Rowling, oh, there you are. Thank you. I probably did something there.
Can I go to where you were?
Okay, there we go.
There we go.
All right.
Oh, wow, that keeps doing that, Dr. Rowling. Once we get to that slide, it just flips.
All right. Well, I'll continue talking here so we don't take up your time. So yeah, so Dr. Jen does follow the science. We do have two flavors though. We have a strawberry, we have a mint. The strawberry was really made for children. There's no foaming in it. We understand that young children have ancillary issues or sensitivity issues, I should say. And so we don't have any foaming in it, but it does contain 10% nanohydroxyapatite. The cool mint does use essential oils, which are great for managing halitosis. When you try your free samples, make sure you brush the posterior of your tongue. Even if you're using a tongue scraper, you're not going to get the fungus that grows in the crevices of your tongue. But if you can gently massage the posterior of your tongue at the end of your brushing cycle, you're going to notice a huge difference even the morning after. You'll notice little to no halitosis.
So I just want to talk a little bit about the essential oils that we put in these products. Remember, we designed this for our daughter's gut, right? We wanted things in these toothpaste that would actually soothe her gut because her gut was pretty unhappy. And so in doing so, we put in, the mint, of course, strawberry for strawberry, but we also put in black cherry and we put in papaya. And those essential oils are very soothing to the gut. They're also really soothing to the oral tissues.
Okay, very good. And then as we already spoke of xylitol, yes, there are studies showing that xylitol can be very effective at reducing bacterial like Streptococcus mutans. Most of the studies out there show 10%. Our concentration is around 14%. We talked about the super paste. This is our game changer. Our super paste, we keep running out of stock. We released this And just I'll back up a little bit. When Jennifer made her toothpaste, gosh, she came out with it a little over 2.5 years ago, actually less than 2.5 years ago. We really made this for our family, for Jennifer's patients. We started selling it on Amazon. And it was a year ago from last April that we started getting calls from dental professionals that had found Dr. Jen's toothpaste on Amazon, and they were using it for their personal, their personal oral care. And they called us and said, will you guys sell wholesale? And so we just opened up our wholesale a little over a year ago. But our super paste is our biggest seller. This is really a breakthrough toothpaste. We filed for or it's patent pending, I should say. We got a application on this toothpaste, but it's the only product that uses 10% nano-hydroxyapatite, over-the-counter levels of fluoride, and high concentrations of xylitol. It's just a great replacement for high prescription fluoride toothpaste. The studies support it. The testimonials that we're getting all over the country, we have many doctors and hygienists sharing that their high caries patients that were previously on high prescription fluoride toothpaste that were consistently getting caries, they're seeing no caries, less oral tissue inflammation because we don't use sodium lauryl sulfate. But the super paste has been an amazing game changer. We hope that when you try it, you love it. The other thing about the super paste, no prescription required. You treat it like any other toothpaste. In fact, most of the offices that buy Dr. Jen's toothpaste, this is their personal go-to product. There we go, the super paste again. And then let's see, I'm not going to talk about floss, but we do make a floss. It's plastic free. As far as fluoride treatment, I did see a question regarding fluoride varnish. I do want to address that. Just be careful. If there's a manufacturer out there saying they make a fluoride varnish and it's just as effective,
a nano
hydroxyapatite varnish just as effective as fluoride, ask them for third-party non-funded clinical studies. We've been experimenting with varnish for a while.
The science is tricky on this because varnishes contain a shellac.
If it is an actual varnish, it has to have a shellac. A shellac is, if you understand like how varnish works, even when wood, it seals the area. So if you put shellac in your varnish, it's going to seal the active ingredient on the surface. There is one manufacturer, I'm not going to mention any names, that is marketing a varnish that doesn't have a shellac quality into it. It's more or less a gel. The other thing is if you read the current studies on nano-hydroxyapatite varnishes, there is one, it's a German company. They're using 20% nano-hydroxyapatite to deliver the same efficacy as a 3% varnish. Most varnish has 5% fluoride concentration. So we have yet to see a varnish in hydroxyapatite to deliver the same efficacy as a fluoride. So just keep that in mind when brands are promoting new products that you're not aware of. Ask them for hard science. So what can we recommend for those patients that do not want a fluoride varnish? Well, we can do a tray application. The toothpaste, if it's a fluoride-free toothpaste, we can put it into a tray for 3 minutes, have them spit, wait 30 minutes. This will be just another option for delivering higher concentrations of nano-hydroxyapatite for those high caries patients that do not want fluoride. We have a lot of dental professionals that are using Dr. Jen's toothpaste. Those are just a couple of doctors. We do sell wholesale. As we said earlier, we want you, all of you that are still on, if you're still on, we want to get you some free samples for your office. How do you get free samples? Go to our website, drjenoralcare.com, register your office, check the box on what type of toothpaste you would like. We'll be sending you free samples. If you like this presentation, we also do free CE events where we could buy you guys lunch and we could educate your whole team on nano-hydroxyapatite. If you like what you learned and you want to move forward with a wholesale purchase, we have a code for being on with us. It's DA100. That gets you $100 off your first wholesale purchase. But as far as prices go, our super paste retails for $25 a tube. Your cost is $15. You do get $100 off your first wholesale purchase. However, regarding the fluoride-free products, they run about $20 a tube. Keep in mind that a typical tube will last about 3 months. We've broken this down. It comes out to about 20 cents a day. So for a patient that wants a fluoride-free 10% nano-hydroxyapatite, it's going to cost them about $6.50 a month. Now, for patients that do not want fluoride, they do not want caries, 10% nano-hydroxyapatite at $20 a tube is a very reasonable investment to give them the same efficacy as fluoride with remineralizing. Let's see, what else do we have on here? I think that's pretty much it on our slides. Am I missing anything? No, so I'll finish it up there because I know you guys have better things to do than to listen to us. But the biggest thing for us is we understand for you to recommend a product for your patients, you're going to want to try it, and we're more than grateful to ship your offices some free samples if you go to drjenoralcare.com.
And Peter, I wanted to remind everyone that at the top of the screen is a red banner, and they can tap on that banner directly. It will take them right to your landing page. And I see everyone is hopping on there right now. You still have about several hundred people on the class. We all appreciate you being here. Questions that are coming in here. Great webinar. Thank you so much. Does this work with SDF?
That's silver diamond fluoride. We haven't seen any studies. That was somebody else came out with a question. So we can't speak to that because we have not read any published studies on PubMed regarding silver diamond fluoride and nanohydroxyapatite. When we do see a study, we will add it to our presentation. Great question, though.
Okay. And my paste rep said fluoride doesn't remineralize. It only occludes dental tubules. What are your thoughts?
Wow. Okay. The clinical study that we showed earlier comparing MI paste, and it wasn't our study, it was a third-party study. What the conclusion was on that is that both nanohydroxyapatite and fluoride will remineralize enamel. And what they said is that the MI paste, and I'm just summarizing it, or CCP, ACP, whatever it is, the liquid phosphate and calcium did provide some remineralizing, but it didn't perform as well as the 10% nanohydroxyapatite and fluoride. So as far as the occluding dentin tubules, I would agree with that fluoride, it's a chemical, it's liquid, and it's going to create fluoroapatite, where nanohydroxyapatite crystals will occlude dentin tubules. As far as the biophysics of MI paste, the liquid phosphate and calcium, we cannot speak to the biophysics of it. What we can share with you once again, or just kind of remind you of, is that the study that was published, I believe it was winter of 2017, showed that 10% nanohydroxyapatite outperformed liquid phosphate and calcium.
Question here, should I have my stepdaughter use this while she has braces on?
Absolutely. I can tell you firsthand, all of my patients are using it, hopefully every day.
Yeah, that's a hard part. I'm just going to address this a little bit. One of the main reasons our ortho patients have decalcification is because they're not spending the right time, or maybe it's the right technique at brushing. It's just harder to brush with brackets on. The fact that nanohydroxyapatite crystals at high concentrations, 10%, they are excellent at helping to reduce biofilm. So even if the patient isn't doing the best job brushing, they will get a higher reduction of biofilm or plaque, which will help reduce the probability of getting the white spots or decalcification areas.
Question here, I can't tell from the slides, excuse me, does one of your products have fluoride and nanohybrid hydroxyapatite?
Yes, so that's our super paste. So our super paste has both fluoride, over-the-counter fluoride, and 10% nanohydroxyapatite.
That was the one that we tested against high prescription fluoride at 5,000 parts per million in a zero-stomy environment, and the super paste outperformed that's Prevalent 5,000, it's in there, by 6 times higher levels of remineralizing. And then, as we said earlier, during the acid challenge, it outperformed Prevalent 5,000 by 10 times with the acid challenge. And this was, yes, it was a pilot study.
Can patients order directly or through their dental office?
So we have some dental offices that sell it, some that give it away at cleanings. We have a website for consumers that they can order as well. We actually have referral pads, so you can tear off a sheet and they can get $10 off their first tube. If you want those, you can just contact us through that website. And then we are also on Amazon.
Yeah, we've been out of stock. Jennifer is very particular with her ingredients, and one of her manufacturers of an ingredient was a little bit behind. It's supposed to come in tomorrow.
Yes.
So if you have anybody who's trying to buy it on Amazon, it's not listed. It will be in most likely the next 2 weeks. We've had, when we created this toothpaste, when Jennifer created this, and I said this before, we really didn't plan on it being as popular as it is. We are truly grateful, though, that the dental community is embracing it and they're sharing it with their patients. So thank you in advance if you do decide determine this is a good product for your patients.
There is a question here. What is the abrasiveness of the toothpaste?
Yeah, great question. Nano hydroxyapatite crystals are super fine. It's like if we go to like fine grit to coarse grit. So the RDA on nano hydroxyapatite in itself is really low. It's like 4. That was a little bit of a concern for us because we do want a little bit of abrasivity to help remove stains and even additional plaque. And so our RDA, we had our toothpaste tested through an RDA test. It came in at 44.
Would you recommend your toothpaste for post-operative or sensitivity from whitening?
Yes, we have a number of offices that were using I'll just say liquid phosphate and calcium before. And think about that. When we go through whitening, like hydrogen peroxide, it is causing major demineralizing. Phosphate and calcium is leaving the enamel, and this is why our patients are getting hypersensitivity. So a tray application after professional whitening is going to be very beneficial at reducing hypersensitivity. It's going to restore phosphate and calcium back into the enamel. And yes, if there is exposed dentin or other areas of hypersensitivity, it will coat and protect those areas. So it's excellent. We've got a number of offices that have switched from liquid phosphate and calcium toothpaste or gel to the 10% nano hydroxyapatite. And they're sharing with us that they're having patients with less sensitivity.
Did we answer the question about toothpaste pH? There were a couple. Okay.
I don't think we did. We have our pH tested with each batch, and it does range a little bit, but generally it's between like 7.2 and 7.4. It's neutral. And as we said earlier, we have these pH cycling events. For enamel to remineralize, it has to be at a pH neutral state. On that note, I think this is a good topic to discuss. It takes about 30 to 40 minutes before pH levels in the mouth come back to neutral. And what's interesting is we have a lot of families that, I think it's the American rush schedule. We wake up, we eat, then we go in, we brush our teeth. It's like, okay, whoa. Your enamel's soft. If you're in a negative pH environment, it's harder to get remineralizing to occur. But having a toothpaste that has a neutral pH, that will help return the enamel to a neutral pH. So long-winded answer, but yes, our formulas, we target somewhere between 7.2 and 7.4 with each batch.
So question here. So what overall should they look for if they're already using a toothpaste out there? What are the characteristics? You had mentioned concentration and so forth. Maybe we could just check off those boxes for them so that they know.
Yeah, great question. Again, based on the current studies on the National Library of Science, including a scoping review study that was published May, we want to have a final concentration of 10%. So that's one requirement. The second is particle size. There are brands out there, I'm not going to mention names. There's a brand that says we use 20% hydroxyapatite, or we use 15% hydroxy. We have the highest hydroxyapatite concentrations. For enamel to have phosphate and calcium actually penetrate the surface pores or get into the dentin tubules, they have to be microcrystals. So this is where
they need to be nano.
I'm sorry, nanocrystals. Sorry, I'm getting tired. It's really interesting. I did a lunch and learn with a dentist not too long ago, and he said, Peter, this nano hydroxyapatite is convoluted. And I said, I love what you just said because I'm going to use that when I talk now. So. But the reality is nano hydroxyapatite in itself is not convoluted. We have brands and misinformation out there that make it really difficult to understand. So really 2 requirements. We need high enough concentrations, 10%, to do all of these wonderful things of nano. And then the second requirement is nanocrystals. Microcrystals are too large. There's brands out there that mix the two. So when you're researching your brands and they're saying, well, we use the highest concentrations, are they all nanocrystals, or are they putting in half nano, half micro? Does that make sense? Did I say it right?
So we want nano crystals at 10%.
And then is following the European safety guidelines, you'll also want to ask the brand, are they using a rod-shaped crystal? Because that's currently the crystal shape that's approved.
Any other questions or comments as we wrap up here? I want to remind everybody that this handout or this document is in your handout. So you have a copy of this. You have a way to reach out later, take it back to your practices, share it. We're getting a lot of questions about this. This is recorded, including all of the Q&A. So yes, you can take that back to your practices as well. You can tap on that red banner at the top of the screen and meet with Peter and his team and learn more. There are free samples that you can avail yourself to. And let's see what else we have here. Thanks, great info. If you need help with the quiz, stay on after this. I'm happy to help you. And I think that is it. We've reached the end of the internet for this evening, perhaps.
Well, guys, thank you for your time. We know there's always better things to do than to learn about toothpaste. However, we really hope that what time you spent with us was very valuable and you become the best advocates you can for your patients seeking a nano hydroxyapatite product. So thank you for your time.
Thank you both. And
Thank
thank you everyone for being here this evening. We really appreciate it. We're going to go ahead and bring that passcode back up for you right here. And again, it's 621156. If you're having problem downloading the quiz and saving it to your phone, that is a device issue. I'm technologically savvy, but I can't get into your phone and do that for you. You might have to use another device, but reach out to us here. For some reason, I can't log in to get samples. This is what Deborah said. Let me tap up here.
If you want to email us at info@drjennatural, we can send samples as well.
Okay, everyone. Again, the code here as we close 621156. There are a couple of you with an iPhone and you're not able to download the quiz. You might have to use another device. What number could I reach out to? Please send me the phone number or the website. Thank you.
Okay, my number is 651. Do I want me to type it in the chat? It's actually on one of the slides as well. It's 651-734-5587. And then we do have a number on the website as well. Dr. Jen Oral Care in the upper right-hand side. That's another number to contact us on the actual website at drjenoralcare.com.
They want to call for wholesale. Yes. Okay. And if anybody has any questions and you need connected, you can also reach out to me and anyone through our website, and we're happy to get you connected with Dr. Jen. So we want to close out now. Thank you all for being here. Please let us know how we can help you. Make sure you reach out to Dr. Jen with any of your questions, and we're going to call it an evening. Thank you, everyone.
Thank you.